welcome all. Okay. Greetings once again. So, as is our norm, that we usually don't like to, take delay so much the program. I suggest we get started. And Paul just confirm that my screen is showing and that I'm audible. Can you hear me? If you can do a thumbs up so that I know I have audience.
We can hear and see.
Thank you. So welcome. My name is David Musyoki, and I work for Kehpca as the executive director. And tonight I'm making a quick presentation as a preamble. I will also moderate the session. We have our speaker, Jessica, whom I'll introduce comprehensively shortly. We are happy to host this Building Sustainable Partnership in Palliative Care webinar. And you're our great resource. We are happy that you decided and you purpose to join us. Welcome so much. As we talk about palliative care and sustainable partnerships, and also aspects around support for palliative care initiatives, mainly through the National Association or otherwise. This is our logo. And if you visit our office, it will look something like this. Somebody mentioned and said it looks like a hotel. I'm not so sure, but that's our office. We are humbled to have such a facility. We located in Nairobi, Kilimani area, along Kindaruma Road, not far from Coptic Hospital. So if you would want to visit, you're very welcome. So I'll make a quick presentation around who Kehpca is and palliative care. And I will make a quick reference to a membership needs assessment report that we did in 2023, and then make a summary of what Kehpca exists to do, matters advocacy, training, and all that. Whenever I am talking about palliative care, this picture intrigues me. And I don't know what comes to mind when you see this picture. If we had time, I would get a bit of audience. But if you want, you can write for me on the chat. What comes to your mind when you see this picture? Definitely, it's a man receiving some attention from a healthcare professional, probably a nurse. But for me, what really hits is the expressions. This picture to me communicates care, it communicates compassion, it communicates availability, and this is what palliative care is all about. Based on WHO definition of palliative care, it is an approach that improves the quality of life of patients, and these patients include adults and children, and doesn't stop there. It also includes extending the care to family members, because when someone is sick, they are not an island. They have people around them who are equally affected. And so anybody with problems associated with life-threatening illnesses needs support and care. And so that is in Kenya, about 1 million Kenyans require palliative care. Unfortunately, only 3% access this care. This just proves the need for palliative care. And there's a great scholar in Uganda who said, we need to have palliative care as available as the air we breathe. Think about it. The National Association has a huge vision, which is quality palliative care for all in Kenya. And we like blue. We promote palliative care for all in the country. And we do this through key areas, key focus areas. One is palliative care advocacy and awareness creation. And we don't do this alone. And that is why we need people to come together or to join hands and help this advocacy agenda. The photos, and these are just a few, highlight some of the work that we do in terms of creating awareness at the community level, utilizing radio, utilizing social media, utilizing print media, TV, and any other system or mode of communication that enables us to propagate and talk about palliative care. We also involved in scale-up of palliative care services, and when the association began, that was about 16 years ago, there were only 14 sites providing palliative care. To date, we have over 110 facilities or units providing palliative care. At least we are moving towards the right direction, and we hope there will be exponential growth even in the near future that will grow palliative care, and we'll not be talking about hundreds, but thousands. Our vision is to have palliative care in all health delivery sites up to sub-county and including, community-based kind of initiatives so that palliative care is available as here, according to the scholar in Uganda. We're also involved in training, education, and research. And so I pause and ask, who is involved in this care provision? With the patient in the middle, there is the involvement of the healthcare worker, families, and the communities. And I'm sure we all fall in either of these categories. When we have the patient as the center of care and they receive attention of the key three pillars, then we are doing well. Specifically around our members for the last three years and in counting, I thought this chart could just give a bit of an highlight. If you want to see the paid up or the members or the people, the institutions that have been supporting the worth cause that the organization does, please visit that link. It's on our website. The first category, number one category of membership is the institutions, the Kehpca members, because Kehpca is a member organization. In 2022, we had 34 paid up members. Those are institutions. In 2023, we had 50. In 2024, in the month of September, we have 52. I need to clap for everyone who has paid up, because I am hoping by the end of the year, this graph will grow beyond the 53. The second category is individual friends. I need to clarify difference between institutions and individuals. So the institutions are the providers of care, and Kehpca being a member institution, these are the key leaders in palliative care or providers of palliative care. And so they make the organization. We have individuals like you and me who support palliative care initiatives, and the individuals are equally important because they become our pillars as individuals. So in 2022, we had 24 paid up members, friends. We call the individuals friends of the organization. In 2023, there were 74. And somebody might quickly ask, why do we have huge number in 2023? We attribute this to the national conference that we host every 2 years. And usually there is reduced or else subsidized rates for those who are either members or friends. So probably that explains the peak. And as it today, we had 34 paid up friends of the organization. I'm sure there will be a question around how much do we charge? For the institutions, we've been charging 10,000 per year, while for individuals, the friends, the subscription is 1,000 shillings per year. When you make that payment and we received that money, what have we done, or what do we do with that money that we receive? Most of the time we plow it back to palliative care initiatives. And these are some of the things or some of the activities that we've supported or we've used the cash to do. And remember, these are activities that are not really funded by other existing donors or programs. So we use the money to do advocacy and create awareness. I am sure Nyeri Hospice, Kitale, and others, including Makueni, they have participated in this initiative that we call Palliative Care Mashinani. It's supporting different palliative care providers to go to radios, local radio stations and talk about palliative care, and we've seen that in the pictures. In October, the second week of October every year, we have a calendar event which is a celebration to mark World Hospice and Palliative Care Day. But the week prior to the second Saturday of every October, we call it a World Hospice and Palliative Care Week. And there are usually activities that palliative care providers organize, and Kehpca has been using the membership funds to support those initiatives. Not huge monies, yes, but they help quite a lot in terms of raising awareness and profile of palliative care. This year, for the palliative care providers, you understand we had a biting stock out of oral morphine since December until around July or towards the end of June. And so we used the membership funds to purchase 2 kilos of morphine, which we distributed to almost all the palliative care providers. And I've been getting reports that it really helped. So your membership money has helped to support a patient in need of essential medicine, which is morphine. We've also used to support admin costs during conferences. We've also used the money to support World Cancer Day activities, which happens in February of every year. We also use the money to register to be members as an organization to other organizations in the spirit of partnerships and networking. And recently, when we acquired this car that helps us to navigate the different places as we undertake site and field visits. So we didn't have enough money. So we used the membership money to top up to purchase the car. And so we are proud of every member and every individual that has stood with Kehpca in its work. We owe this to you. Why do we do this? It's based on, a strategic aspect. So Kehpca has 4 strategic pillars, and pillar 1 talks about member revitalization and development. This tool cannot be strong without this, do I call it a leg or a pillar? And so the pillar is to build and strengthen Kehpca membership and establish a vibrant movement for the advancement of palliative care in Kenya. We have you in our thoughts and we esteem you highly. For us to have sustainable solutions, which is the topic for today, and to be able to strengthen Kehpca, this pillar needs to be strong. And that is why we're doing this webinar today. Before I close, in 2023, we did an assessment focusing on the member paid up organizations and friends. We went to other institutions that were not necessarily members, and we also interviewed the common person, the Wanjiku and the Kamaus and the Mutuas, and just to list a few. Anyone on the streets, and we got quite some good feedback around what Kehpca is all about and what we do. Majority of the common person did not know what Kehpca is, neither did they know about palliative care. So we've only scratched the surface, if I would say, based on the needs assessment that we did. To an extent that even some of the members did not understand the benefits and the role of Kehpca, not fully understood. Some of the institutions also did not fully utilize the benefits that we outline as being members. There was also concern around how Kehpca governance runs. And then a few friends expressed that it wasn't very clear what their role would be. And the good thing is about the membership fee, huge numbers said, actually 100% said they would be willing to pay the membership fee. And all the participants approved Kehpca's work to improve palliative care advocacy. I just picked on this to provide feedback, even as we talk about sustainable partnerships. An example of some of the questions that were asked the question was, is it appropriate for Kehpca to request for a membership fee to all members? And 75% said yes, while 25% said no. The other question was, would your organization consider paying a membership fee to Kehpca commensurate with the benefits offered? And 100% responded and said yes. Because of that, we are comfortable and feel empowered to do this webinar so that we explain why it is important to have these kind of partnerships. And so there was a recommendation about the need to improve visibility and continue advocacy, the need to continue technical support and training, and the need to continue to support and in terms of membership fee. And those who have interacted with our staff who are solely responsible in terms of recruiting, I'm sure you've seen emails from either Josephine or Emily with these nice pictures encouraging us to subscribe every year because you are supporting a worth cause. When you see that email, please don't be bored. Just do what you need to do. It's our appeal so that you'll become part of a winning team. Based on that, strengthening palliative care as a component of comprehensive care requires involvement of many stakeholders. As a key stakeholder and being part of this webinar, it's my appeal that we all play our part so that the railway line makes sense. Please follow us on our social media platforms and give us feedback. And that said, thank you very much. I will pause at that, and I will be happy to introduce our main speaker for the day. We will take questions at the end of the webinar or towards the end. So as Jessica projects her presentation, allow me to tell you who Jessica is. Jessica Kilonzo is the Executive Director at Steps Ahead Consulting, and she has quite an experience, over 20 years of experience in organizational development and training. She is very passionate about strategic thinking and planning, and she's been a great pillar for palliative care in many ways. Through Steps Ahead, or when we consulted Steps Ahead at some point, and we partnered as an organization to do or to develop our first and second strategic plans, which we are implementing to date. And we are really proud to have her speak to us about building partnerships for palliative care. Allow me to just say in a nutshell, she is a certified international NLP coach, and her bio is really huge. We are happy to have her. And without much ado, allow me to usher her in. Jessica, the floor is yours.
Thank you, Musyoki, and a very good evening or good day to you wherever you are. Am I audible?
Yes.
Just is the PowerPoint presentation is visible, right? Sorry. Are you seeing the presentation or are you seeing with the notes?
Now it's okay. Now it's on slideshow.
Okay. All right, welcome everyone. It's a pleasure to have you all here today. for this important conversation on building sustainable partnerships in palliative care. Whether you're representing a not-for-profit organization, a for-profit organization, a government agency, coming in as an individual, a member of Kehpca, or even part of Kehpca's board and secretariat, or even attending in whichever capacity that you come in, you play a critical role in shaping the future of compassionate care for individuals and families, particularly during their most vulnerable times. It is an honor to speak to such a diverse audience of healthcare professionals across the board. And today we'll be delving on essential topics that relate to building sustainable partnerships for palliative care. At the same time, being able to look at how we can enhance collaboration. I'll be happy to share with you some key pillars, and I say some because there are very many ways and approaches to be able to strengthen collaboration in the long term, so that we can see how we can explore ways of strengthening partnerships. I'm glad to hear the journey of growth that Kehpca has gone through. Having journeyed with Kehpca years back in supporting the development of the first strategic plan, the review of the second. So as I listen to the journey that they have taken, it is good to see that this continuous listening, continuous engagement, the membership growing, as well as being able to support organizations and having that vision to ensure that palliative care is available in every part, in every corner of this country. Why are we here today? Just a quick overview. One is we aim to respond to the rising demand for palliative care amidst limited resources. And I say limited resources because when people talk palliative care, it is not one of those areas where funding just flows in immediately. There's a lot of resource constraints, and that requires a need for key partnerships so that then we can be able to support people. Palliative care also takes time because we know the journey of patients over time, and that also means that resources will be required over a period of time. We also recognize through the conversation today the importance of pulling together to be able to fill care gaps and increase access to quality. A few key objectives that I thought through when Musyoki approached me was that we would be able today in our meeting to explore the importance of sustainable partnerships in palliative care and why they are critical to ensuring quality long-term support for patients and their families. Next, we'll also look at some of the key pillars for building and maintaining partnerships. It's one thing to build a partnership or to get it started. Maintenance is very key, whether you're engaging with government, whether you're engaging with funding agencies, whether you're engaging with the communities in which you're based as an organization, or whether you're engaging with other partners that can come in and complement the services that you provide so that what you provide is holistic in nature. And we'll also look at resource mobilization techniques. And why I single this out is many times and over the years of experience of doing organizational development support, it's like a chicken and egg scenario. People will ask, we just want to know how we can get the money or the resources. And the first thing that I say is, until you have put your house in order, it's very difficult to begin to attract resources because yes, you can easily get resources today, but then if those resources are not managed in the right way, there isn't accountability, transparency, then that ends the whole engagement with whoever is providing those resources, or you end up having to go through a similar cycle of starting relationships and not maintaining them. And hopefully be able to discuss some examples or cases that highlight the role of partnerships and resource mobilization in improving palliative care services. Allow me to put off the video if that's okay, then that will make it easy for me to juggle between the presentation and talking through. So building sustainable partnerships in palliative care is essential to providing consistent high quality care for patients while also supporting healthcare providers. And when we talk about sustainable palliative care, we need to understand that it does not only mean delivering best class care to achieve the desired outcomes for both healthcare systems and patients, but we also need to ensure that we are not overwhelming and burning out the caregivers who are involved in this emotionally demanding work. So we are looking at all the different stakeholders that come together to make sure that palliative care is quality and is available to people. Moreover, when we talk about sustainability, we want to see that it ensures that vital services remain available and accessible at all times, even in times of uncertainty, such as when external funding or even donor support fluctuates. And that calls for developing strong, adaptable partnerships. That word adaptable uh, reminds me of the famous quote that says, "What made you successful in the past will not always make you successful in the future." And so, whether we are in healthcare, whether we are in business, in whichever aspect of life we are in, adaptability is what will continue to keep us successful. And hence, the question for us, even as we engage in our conversation today, is how are we constantly adapting to the changing needs, to the changing demands, and even emerging concerns for care that come up on a day-to-day basis? And by as we continue to be responsive, are we adapting our techniques, our methodologies to remain responsive on a day-to-day basis to the community that we serve, and particularly to the needs of the audiences that we serve?
Jessica, if you don't mind, you can do a slide presentation.
Did it stop? Sorry.
Yes, when you are switching to the video.
Oh, apologies. Okay. I thought, okay, so let me see. Can you see now? Or is it slow?
Still the same.
Let me try and share again.
Okay.
Is it visible now?
Perfect.
Oh, sorry about that. Okay. So without talking much, because majority of you are in healthcare and deal with palliative care quite often, these are just among the many challenges that you're seeking to address every other day. And palliative care continues to face significant challenges of access, lack of awareness, resource limitations that make it difficult for patients to receive comprehensive care. And so partnerships and resource mobilization remain critical in scaling up palliative care efforts, particularly in settings where health care systems are overstretched or where specialized care is lacking. It is for that reason that I would indulge you in being able to talk about some of these key sustainability pillars, which I hope that as we go through the discussions, you'll take time to think about your own setting, whether you're a small institution located somewhere in a remote part of this country, whether you're a big institution that is serving hundreds of clients and patients every day, the sustainability pillars will apply to you. And one of them that I would like to talk about is shared vision and mission, aligning around your common goals to unify efforts. I'll also want to talk about effective communication and transparency, where we say that for you to have strong networks, for you to be able to sustain communication and continue to build on palliative care work, there has to be a two-way mechanism of communication that fosters trust and collaboration. Good governance, Musyoki just talked about that when he said from the survey, governance was one of the areas that came up, whether it was people not understanding clearly what the Kehpca governance looks like, But I'll also be challenging and moving to your individual institutions to ask, how are you setting up your governance system? And does that governance help you to be able to provide good leadership and oversight to the teams and organizations that you run or that you are a part of? Strengthening, organizational strengthening and resource sharing, where we say that for you to be successful in achieving your vision and mission, you will need to set up certain basic systems and structures that will provide a foundation or a pillar upon which then the execution of your mission will become easy, and you will be able to work towards achieving those goals, whether it is in rallying teams that you want to put together, or whether it is in ensuring that there are the right protocols, the right policies, and even standard operating procedures to govern how you operate as an institution, that whether you're there or not, people will still continue to function in your presence or absence. Ethical considerations, cultural competency, and inclusivity, providing care that respects the cultural, religious, and social values. I'll also want to talk briefly about diversified funding, and bringing it all together is monitoring, evaluation, and adaptability. So allow me to go to the first pillar, which is shared vision, mission, and sometimes we even add values. Many times when we talk about a strategic plan for an organization, some of the core things that you'll always find in every strategic plan is shared vision and mission. And what does that really entail? It is thinking through the direction that you want to set for your organization. It is pulling people together so that the dream that you have can be executed. But for that to happen, people need to be bought into what cause you are advancing. People need to feel that what you're calling them to come and be a part of is something even bigger than yourself. And that's why you find vision and mission statements that are crafted for organizations. But beyond the crafting of that vision and mission is also how that vision and mission gets lived on a day-to-day basis and implemented. Um, I like to use an example of the 60s when one of the American presidents had the vision of taking the first man to moon, and NASA was the engine through which this was going to be executed. And it is said that a senator, the equivalent of our leaders here, went to see the progress of what had been done and visited the space station. And while he was walking along the corridors, he stopped by to say hi to a cleaner and engage in a little talk, and asked this cleaner, so who are you here and what exactly do you do in this great institution? And the cleaner looked at him straight in the eye and said, I am working towards taking the first man to moon. He could have said many things. He could have said, don't you see, I'm here cleaning. He could have said, well, my job here is as a janitor, I make sure that the floors are clean. But he was convinced and he had embraced the conversation that whatever he did, however simple it was towards taking the first man to moon. Whether it was cleaning the floors, whether it was wiping the desks on which people were working, whether it was ensuring that whatever environment he was in was clean, but the focus was taking that first man to moon. So the question that I have for all of us who are here today is, in your institutions, in your teams, as people rally together and wake up, do they come with that energy, that gusto? Do they have a shared vision that they can clearly articulate? If I were to come into your organization and ask you or ask any of your team members, why are we here? Would they speak a common language that shows that they are rallying their efforts towards ensuring and working towards ensuring that you are achieving the goal that you're setting out to do? First of all, is there clarity in what you want to achieve as a team, as an organization? And then secondly, is this well communicated to the team and to everyone that comes on board? And when I say to the team, it's not just the healthcare providers that you work on a day-to-day basis, but even how your actions translate to the way in which you provide care to the patients, to the caregivers who accompany the patients, or even caregivers who are part of the institution. So as we have this conversation, my challenge to you is going back again to ask, and even to challenge your team tomorrow when you get to the office, are we on the same page, and which page is it? Do we share the same end goals? What end goals are these? And why do we do what we do? What makes you wake up every morning to want to come to the office and do what needs to be done? And a big kudos to Kehpca, for example. If I take examples of how mission is aligned, um, over the years, Kehpca aligned its mission with the Kenyan Ministry of Health with the shared goal of integrating palliative care into the national healthcare system. And this partnership has led to training of healthcare workers, which also translates to recruitment of healthcare workers to palliative care, and hence them being the ambassadors or marketers of palliative care to be in every healthcare institution, public or private, within the country. And because of this shared vision, Kehpca and its partners have been able to create care across the country and create sustainable model that continues to deliver high quality care. I'm also reminded of another palliative care association in Zambia, the Palliative Care Association of Zambia, that partnered with the Ministry of Health and non-profit organizations, communicated their vision very clearly, and their focus was to provide palliative care access in rural areas. Over the years, they've been able to reach very many parts of the rural areas. And with this common mission, the organization has worked together to integrate palliative care into the country's primary healthcare system, ensuring long-term sustainability. So hope these are just, I'm just giving this as examples to get us to think through what we stand for and how are we executing that for which we stand for. When you also have those conversations, documenting this becomes very critical, whether it is at the team level or within the department level, cascading all the way up to the organizational or institutional level. Now, when you have your shared mission and vision, communication becomes key. But why we also add communication and transparency is because they are vital pillars of any sustainable palliative care partnership. Partners that maintain two-way open communication foster trust, collaboration, and problem solving. And good communication, allow me to say this, goes beyond writing reports, sending videos of what you've done, and regular meetings. It's about creating a culture where feedback flows freely in both directions, meaning that as the leadership of the organization, there is information that is trickling down, providing guidance, providing leadership, creating a roadmap for where people want to go to. Yet at the same time, openness to be able to listen to the people that work on a day-to-day basis, engage with patients, and have their ears on the ground, and the feedback or the input that they bring in, creating avenues within the organization or the institution or within the team for open communication, where we say, let's look at how are we doing, let's look at the challenges that we are facing, and how do we work towards mitigating or addressing the challenges as they come along. Transparency is also about seeing the big picture, which helps to keep everyone aligned with partnership goals. When you're transparent, uh, and transparency could begin with the simplest of things, such as you have received funds from funders. How are you accounting for those funds? You have received opportunities, say, for training for people within your team. How open are you about being able to communicate this? So when we talk about transparency, it is also the clarity of information and ensuring that when information is shared, people have an opportunity to engage, interact with it, and make good use of it in such a way that it provides more progress within the organization. I'm reminded of the Hospice Africa of Uganda in 2020 during COVID. This is an organization that I'm sure some of you are familiar with, that partners with international donors, local government agencies, as well as community-based organizations. And one of the things that is attributed to their success is their open and transparent approach to partnership management. If you go to their website today, you will find their current strategic plans, you will find their annual reports, you will find a broad exposure of all the activities that they are engaged in. And I remember during COVID, quite a number of their partners, they opened up to their partners, clearly communicating the challenges they were facing in delivering palliative care. And because they have continuously put out information, then it became easy for even partners to accept to reprogram some of those funds, as well as provide more additional funding to support them in the constraints they were having. So it's very important to ensure that communication and transparency for whatever resources are provided is something that is taken seriously. Now, when you have a good vision, you are able to communicate and maintain accountability and transparency. Good governance is equally one of those key things, because it helps to maintain clarity of roles. It's about providing oversight. It's about providing leadership, whether at the top level or even within the team. But most importantly, within every organization, if the governance structure, the oversight of the organization does not have clarity, then the organization will not execute on its goals and objectives or expected outcomes. So good governance begins with, first, what kind of people has the organization? If, say, for instance, you're a palliative care or a hospice, what kind of people are you bringing onto your board? Do they have the relevant skills and qualifications to support you to be able to implement what it is that you want to do? Do they have commitments that will enable you to move forward, meaning that when you call upon them, they will be available to serve, and in most cases it is to serve on a voluntary basis. So first, the people that you select make a big difference in terms of the kind of governance that you will have. Now, some of you may be asking, I may be not a very big institution or, relatively young organization. Why do I need a board when the board will come and perhaps disrupt the operations? And, sometimes we've also had about boardroom wars come and make life difficult for us. The answer to that is in any setup, how you choose your board will determine the kind of people and outcomes that you get. But most importantly, no matter how small a setup you have, having a good board will actually enable you to have more minds that can help you towards thinking and make better decisions. Having a board of people that are competent in what they do also helps you to work harder towards achieving the goals that you set, because you do remember that you have someone that you're accountable to at the end of the day. Having a good board also helps you in terms of compliance, because they will scrutinize, not in a bad way. We are not expecting them to be police, but they will come and scrutinize, critique, and see where the gaps are, and provide feedback or support in how you can address those existing those existing gaps within the institution or setup that you're in. So I challenge and also encourage all the members of Kehpca who are here, work towards establishing boards to start with. It can just be a committee of people that in the long term will come together to support you to establish that formal board that you want. But when you have a good board, the focus should be on clearly defining roles and responsibilities. ensuring that the people that you bring on board create transparent financial processes, and also that they will establish regular mechanisms for two-way communication to the staff and back from the staff to the leadership, and again from the leadership or the board to the staff. That way, when people feel valued, when people feel that there's open communication, they're more apt to give you continuous feedback on what can be done. And that is what makes organizations flourish while others continue to diminish. And then, of course, as you work towards putting in place boards, if you don't have, they do help you in terms of documenting decisions and progress. So the question that I have on this pillar is, one, do you have a governance structure in place? Two, if you do have a governance structure in place, is it a governance that helps you to move forward rather than just be a governance for rubber stamping decisions that need to be made? And three, how can you continue to improve upon the governance of your setup so that as an organization, then you're able to move forward in implementing your overall mission and vision for your organization? Take time to think about that, and have even further conversations back with your team members when you get to the office. The other pillar that I'm interested in, and maybe I'll say I live and eat every day, is organizational strengthening and resource sharing. And at the beginning of my presentation, I did mention that organizational strengthening is about setting the foundation. You have identified the vision or the roadmap of where you want to go to. You have clarified why you exist, which is your vision and mission. You have set up a governance that will provide oversight and leadership. The organization itself then becomes this empty shell until you start to put in place the necessary structures that will support you and provide pillars for growth, whether it be accountability in terms of the quality of care that you provide, whether it be accountability in terms of the resources that you are providing. And strengthening of internal capacity requires a couple of things. One is training people, whether it is in clinical training, governance, financial management, or even patient-centered care. It is in thinking about organizational strengthening that you're able to do an assessment like Kehpca did and identify where the gaps are, and then plan and prioritize how you can begin to fill in those gaps. Why is it important? A good house that has a good setup ensures then that the people that live within that house are comfortable, your patients will be comfortable, your staff will be comfortable, it will be easy to get things done. There is more orderliness in execution, which then also translates into time-saving processes. What it also does is that by strengthening your organizations, you develop systems and ways of doing things that remove the individual from the system. And by this, I don't mean becoming impersonal, but I mean that if Jessica is not there today, and this is her way of doing things, someone else coming tomorrow can continue to implement, can continue to provide services in the same manner with the same level of consistency that Jessica does, or even better, because we have established protocols, we have established standard operating procedures, we have established policies that provide guidance for different scenarios and situations that happen within the organization. And out of that, then, you're able to grow the organization. Sharing resources also becomes very key. And when you talk about sharing resources, it's not just about financial contributions, but it's also knowledge, technology, staff expertise, and infrastructure. One organization among your member organization might have advanced technology, while another has a local pool of expertise or outreach capabilities. Are you leveraging on the different competencies and the different strengths that are brought in by the various members in the different regions that you're in, so that you avoid duplication of effort, and that by leveraging on this on whatever competencies, skills, and resources that you have, then you're able to do much more. There's the famous saying in Africa that says, if you want to go far, if you want to go fast, go alone. But if you want to go far, you need to tag along many more people. And so I think when we talk about resources, it is being able to leverage on different people. When as Kehpca members, you meet and engage with each other, do you take time to examine what kind of strengths does each member bring in beyond just the financial contribution that members are making? And how can we tap into those strengths to make sure that the membership continues to strengthen, and that inevitably leads to the strengthening of the individual units or organizations or programs wherever they're situated across the country. And then, of course, seeking external partnerships and funding. As we talk about organizational strengthening and resource sharing, then it's also important to build internal strength and external resources by actively engaging in fundraising and diversifying your funding capabilities, so that then you are able to maximize on different opportunities available, and you're not reliant on only one funder or only one person that is supporting the organization, which can be very dangerous. Pillar number 5, ethical considerations and cultural competence and inclusivity are fundamental for delivering high quality patient-centered palliative care. Ethical practices guide us to treat patients with dignity, respect their autonomy, and also ensure confidentiality in all aspects of care. It is one thing to talk about sustaining long-term relationships, talk about building organizations, building institutions. But at the end of the day, the core person, that why we are doing all this is for the patient, and to make sure that they are as comfortable as possible in their journey of life. So bringing that aspect of humanity is something that we need to constantly remind ourselves in, given the sensitive nature of work that we do. And so when we talk about cultural competence, palliative care must be tailored to diverse cultural, religious, social context in which we work. Those are things that we must continuously remember for us to be sustainable. I remember some years back, Medicines Sans Frontières in MSF, as they are called. I'm never sure about that F part, how to pronounce it. Did delve into Afghanistan, which is not an easy environment to work in. And they had some challenges at first in terms of adapting, because the culture they were coming from and the culture they were going into are slightly different. But they worked on implementing a culturally sensitive palliative care approach. They trained their staff on local customs, engaged community and religious leaders to ensure that their care was delivered in a way that was respectful of cultural and religious values. They adapted their medical interventions to align with patients' end-of-life wishes, such as religious rituals and gender sensitivities. For example, they ensured that female patients had access to female healthcare workers, respecting local norms of privacy and dignity. And because of that, over many years, different organizations have made their way in and had to leave, but they continue to provide palliative care support and are known as one of those organizations that has managed to do outreach in difficult places. So back to us, when you think about your setup, what kind of culture, one, are you setting? How are you communicating this within your teams? How is it implemented? Do we take time to read the pulse of the communities that we are working within or that we are embedded in? Do we take time to create initiatives that are proactive and respond to the needs of these communities, while our focus is to ensure that palliative care is core, and how we deliver is that consistent across the board within the teams in which we work? So these again are questions that we need to be asking ourselves, so that at the end of the day, when patients encounter, whether it is Mary, Judy, Peter, they have that experience of a sense of dignity across the board, irrespective of who it is that they work with. The other pillar that I want to come to as we wind up on this presentation is diversified funding. And build financial fundraising, as I would like to say, is essential for building partnerships. Relying on only one source of funding, and why we say diversified, as we have seen over the years, can be very dangerous. Sometimes organizations fall in the danger of getting comfortable because maybe they have multi-year cycles of funding. But lately, we are seeing a complete shift in the way funding cycles are happening. We are seeing a complete shift in priorities for funding. We are seeing a shift in even where the funding is heading to. And so that calls for realignment, particularly if you're an organization that seeks funding, to ensure that you are looking at multiple sources of funding, whether it's private sector corporate partnerships that you work with, as we see with Kehpca and their annual dinners, whether it is philanthropic and donor organizations that you work with. And there are many creative ways that you can engage donors with. One of the pieces of advice that I always give organizations is, many will say the donors that we meet are not funding palliative care or are not doing work that relates to palliative care. But I also say, and I challenge the same organizations to say, people may not necessarily do that which relates to the name of what you're doing or what your mission delivery is about, but you can rework your initiatives and be able to reframe the way you're communicating what you do, so that then the donor sees a relationship between what you're communicating to them that you can do and what their mission and vision is all about. That way, then you can tap into multiple sources of funding if donor funding is one of the areas that you target. And then, of course, there's social enterprises where people are moving towards. Although I would like to say with caution, social enterprises can be very tricky. And when we say social enterprises, sometimes it's pretty much what people call the income generating kind of activities that are meant to plow back whatever resources you make to the organization. And starting a social enterprise requires a different set of skills from what you're used to on a day-to-day basis. So even as you think about setting up a social enterprise, because maybe we think that is one way of raising funds, it can also be detrimental or even, fall back on you. So when you think about a social enterprise, certain things that I would say as caution is, don't start a social enterprise where you're expecting, say, to work with patients or to engage patients towards being able to generate the funds to continue to support maybe the hospices, even if they're, reasonably on their way towards health and they want to keep busy. That can be something creative that they do as an initiative, but not something necessarily to raise or generate income. When you're doing social enterprise work also, it's important to note that the people that you bring on board to start that initiative should be people who are business minded, not people who are used to running social work as civil society organizations do, because the two have totally different sets of skills. And then, of course, there's community fundraising and crowdfunding, such as the GoFundMe and many others that people participate in. But it's also important to realize that as you do some of these initiatives, they do require a lot of time, a lot of energy. So that also means that you need to recruit a team of people, say, who are vibrant. When you go on platforms like GoFundMe, then you might want to engage a team of our now popularly known Gen Zs as volunteers, because they are very active online, and they will be very good at being able to mobilize everyone to say raise 10 shillings, 100 shillings, 50 shillings. And some of these campaigns go by the numbers. So the more number of people that you get to contribute gives you better options, as opposed to trying to find one or two people that will contribute a significant amount of money. So whatever fundraising approaches that you're using, and maybe this we can discuss in a different webinar, you need to put a lot of thinking into the mechanism and the way you're going to execute it, so that then you don't start something that becomes fatiguing and even sometimes diverts you from your core mission that got you to doing what it is that you set out to start doing in the first place. The last pillar is monitoring, evaluation, and adaptability. What is this all about? Ensuring that we are continuously evaluating. Are we on course? Are we keeping the main thing the main thing? How did we perform? Did we achieve the goals that we set out to achieve? If we haven't, have we lost course? And is it okay for us to lose course? Maybe that's the new way to do things. Or do we need to reset ourselves and get back on course? Or do we need to completely start change the way we are doing things to get better and different outcomes? And that requires putting in place the right mechanisms, putting in place setting up some basic tools that can help you track progress, and of course ensuring that there's constant conversation, communication, feedback loops, so that issues that keep coming up are addressed on an ongoing basis. A lot of ME, we always add learning to it. And it's important that even after we have evaluated and have seen what progress we are making, that we also look at adaptability. Now that we have learned the lessons that we have learned, both the good and the not so good, seeing the challenges that we have experienced, how are we adapting so that we embrace new ways of doing things and new approaches to getting things done. Allow me to just highlight as I hand back over to Musyoki, an example. I would like to go back to fundraising and highlight an example of resource mobilization. And this is where I was talking about a social enterprise. We have NOAA, which is Neighborhood Old Age Homes, that started off as a nonprofit entity, has funders and donors, but over time they realized that they needed to also bring on board, to fundraise locally and be able to find ways of sustaining how they operate. And they provide affordable housing for a very small rent for elderly people and operate a primary health care clinic because of the age population that they're working for their members and surrounding communities. And so when they decided to embrace the social enterprise work, they started thrift stores that have been operating very well. People come donate items if they are of good value, then the items are put in the shops and anyone can go and buy these reused items in good condition. And of course, the money that is made out of that helps to sustain and complement, the extra maintenance charges for the homes that they run. Community agricultural projects have also been some of those very successful projects that they have run, and they continue to do that. However, along the way, they have also run very unsuccessful projects. They did start what is called a candlelight making business. And what they realized somewhere along the way was that the people making the candles were coming to do it as a hobby. And so that meant that it was not really a business, and they had to rethink, do we still continue the project? Yes, but do we move our mindset from generating income? Yes. And that way, those who want to do artistic work continue to do their creative arts, but it is not as a way of making money. However, when they make some proceeds out of it, then of course it is something that they are grateful for. And you can see these are different ventures that they have started. They also started laundry services. And again, they were faced by competition of bigger entities in the competitive market, people with bigger machines and more effective machines. And so they had to close that down. They did start a bakery, but then there were also challenges of the equipment that they were using and the returns they were making out of their inputs into production. And so you will notice that even in your community setups, as you think about social enterprise, it's important to look at how that is, it's important to look at the benefits and the cons of going into business. Recently, I sit on a board where we have social enterprise activities. One of them being running a fleet of vehicles, although we are a legal aid organization. But the reason we started the fleet of vehicles is because we had projects countrywide. And at some point, we had to bring it down to just 2 vehicles because we realized the cost of maintenance was very high. We started consultancies, and that is something that is picking up. So again, you need to look at competencies. We looked at our competencies and asked, what is it that will make us more profitable consultancies? But then as we were thinking about social enterprise, and we had a consultant who came on board and asked us, why are you trying to get into business and you rely on donor funding? And we said, well, the funding has been shrinking. Is there, part of going into social enterprise is to be able to raise additional funds. And the analogy she gave still remains in my mind because she said it's like taking Safaricom as a company and Safaricom Foundation. So Safaricom as a company gives money to Safaricom Foundation to be able to run social programs. But here we are, a civil society organization trying to set up and run a for-profit entity. So Safaricom Foundation now being the one that is giving birth to Safaricom, in the hope that in 10, 15 years time or 20, 30 years, we'll be able to recoup our benefits. And so the question was, are you putting your efforts in the right direction? And I'm sharing this because it's also a question that I would be asking of all of you that are looking into social enterprise. Not to say that you shouldn't do it, but it is what and how you do it that will determine the kind of success that you get. And last but not least, I also want to pull out a Kenyan example. We have a Fecto Foundation that does a lot of work in supporting and empowering youth in education. And what I love about the model of Affecto Foundation is that they started off by fundraising on very small amounts of even 100 shillings challenge, running it over a period of time to support the underserved kids who cannot afford education. And over the years, the foundation has grown in a very big way to even enlist on GoFundMe, to enlist private public partnerships, and is running serious digital literacy and career skills that will then help young people to be prepared for life even as they exit the program. It is the same students who come to support and help with the program. So as you work in the various hospices that you're in or the communities that you're based in, what kind of, how are you utilizing the members and community that you work with, but also adding value to them, adding value. I would like to emphasize on that in such a way that people feel compelled to want to be part of the mission and vision. Kehpca, what value are you selling to your members on a day-to-day basis? The hospice of where it is that you're based or healthcare institution where you are, what value are you creating that every single day people will want to be part of, or the community will want to rally around so that they can support you? When you call them for the dinners, when you call them for the various events, they come running because they can see the value and they perceive it and experience it. So these are just thoughts for us as we engage in thinking about how to sustain partnerships. I did leave the part on fundraising towards the end, but all I want to say is that that was not the main focus. The main focus is build your organization, build your systems and structures, ensure there's clarity of vision and goals, and then identify how to bring in the resources, because no matter how good the plan is, if you do not have the resources, the plan then again cannot be executed. It's more like a chicken and egg story. If you have the resources but you do not have the plan for execution, then again things will not work. Thank you, and I would like to hand this over back to David.
Wow, that was great. We can clap for her if you can find the symbols. Thank you so much, Jessica, for that intriguing and thoughtful kind of a presentation. And again, a clap to everyone for staying in and being keen to, hear and be part of this. And definitely one thing or two things come to mind based on the presentation, that the pillars presented, the 7 pillars, are really key for any organization to talk about sustainability. And just to outline that Kehpca is walking the talk. We do our best to keep all this, and your feedback to us is equally very welcome. We also would expect that all the members, walk the journey. And like we always affirm, that we will do our best as the umbrella body to, hold your hands through. Sometimes we've visited, and this is meant to help us make a reflection. Sometimes we've visited the palliative care providers, and at times it's heartbreaking to hear that their boards or their governance structures haven't had a meeting for a year or two. And yet we expect to have, to meet and to address the challenges that so exist. So it becomes really difficult. So we have to be very intentional how we run our institutions. And let's remember, eventually it's to support a needy patient. It's to support, we exist to support patients facing life-threatening illnesses, walking the journey with them and making palliative care sensible. The government is moving and talking primary health care, preventive medicine. How do we position palliative care in that conversation? And as I pick comments and questions, again, I throw a challenge to us. It disturbs when you hear, healthcare workers say, what is Kehpca doing for us? I wish we converted and changed that conversation to, what can we do together? And definitely together we will go far. Many thanks to everyone for participating. So I don't know, is there any question or any comment? Let me go to the chat. Shem is asking if we can share the slides. We will be able to share the slides, but later, not right away. Thank you, Shem. I don't seem to see any other question other than just some few comments based on the few highlights that I had done. I think it's in connection to the picture that was communicating compassion, care, and Teresa is acknowledging that the morphine was very helpful, especially to patients who required support in pain control. I don't know, I can pick 2 or 3 questions if they are there. If you have any question or comment, feel free to write it, or you can raise your hand. We'll see whether we can unmute you. We usually do webinars this way to avoid lots of disruptions during the presentation, so we control the mics that way. Any question or comment, feel free. Otherwise, I believe we have learned and we are looking.
Okay, we have a hand up from Samuel.
Okay. I have a great team behind the scenes. Paul, are you able to unmute Samuel? And as Samuel is being unmuted, Victor has written, one of the challenges we face in fundraising and partnerships is navigating religious and cultural differences, especially between Christian, Muslim, and other communities. How can faith-based organizations like Christian and Muslim groups work together effectively across these cultural boundaries to build inclusive and sustainable partnerships in palliative care? Jessica?
Well, let me respond, Victor, by saying that first, disease does not know religion, does not know tribe or ethnic backgrounds and the rest. And so the same way people rally when there's a disaster, I would say those are some of the strategies that we need to look at and see what is it that really brings together. At the core, people are very open to being supportive. And one of the challenges we've seen with organizations over the years is how they package their information and how they frame their information in such a way that when they are reaching out to people, what are you selling to whoever, and allow me to use the word selling. What is your message communicating to the people that you're reaching out to when you're enlisting their support? When you want to reach out to, say, a different religion that is different from yours, or you find yourself in a community where there's the cultural, religious differences, at the core of who we are similar in the way we operate. So as we think about our communication strategies, we need to ask what's in it for each of the different constituencies that are in the community that we are in. What does the Muslim, for instance, want to hear, and how do they want to be engaged with? What does the Christian want to hear? How do they want to be engaged with? And begin to craft messages that go up and above how we relate with each other in terms of our religious backgrounds. Cultural sensitivity training also within the team is important, because if I come to an institution, even if it is a Christian and say I'm a Muslim, and the kind of care that I receive is telling me that these people see me as a human being, not as the kind of religious background that I come from, by continuously training and sensitizing people within the teams, then you encourage people to be more adaptable to whichever kind of people that come. So I would say the packaging, training people on a day-to-day basis and ensuring that the sensitization is something that is ongoing within the organization, and then crafting a strategy for communication. Every organization, big or small, needs to have a strategy for communication. Who are your audiences where you operate within? How do you tailor the communication to those different audiences in a way that touches and reaches out to them? And finally, like I said, what's in it for them? Everybody has something that they would like. Reach out for that emotional appeal to that individual. Thank you.
Great. Sure. Samuel, go ahead.
So thank you so much for the opportunity. For my side, I just have a few contributions in regards to the presentation on resource mobilization. So this I just want to share with you based on an experience I encountered with another organization that I would propose to Kehpca to try integrate their program to the digital space. There's a lot that is happening in the digital space, and the larger population is actually very active on a daily basis in the digital space. And in that regard, I would maybe propose like Kehpca to be very active in their social media spaces like YouTube, so that then they can monetize the channel. Those are areas where those resources can come from, the monetary resources. So even Facebook, they can monetize. The other, like Twitter, can also be monetized. So I was going through, I think it was last week, going through the Kehpca YouTube channel, and I was surprised to find like the latest post was done in 2 months ago. So with that, it will not be very easy to tap any coin from that site. So then a lot of work needs to be put in place so that at least maybe a deployment of someone who can run the digital spaces so that at least some few coins can come from there. And things like digitizing some products like maybe ebooks. So yeah, I think you can work on that so that whenever one wants to download some of these materials, then they have to pay some coin. And that coin finds itself into Kehpca account. And then working together with the skilled people in technology to come up with a Kehpca mobile app. So just like we are having a WhatsApp app, so we have an application for Kehpca. So whoever downloads that application, then there is an agreement that is to be made between Kehpca and maybe the Play Store company, so that there's how they sort themselves behind the scene in terms of money. Then the other thing is what we call when the platforms have been digitized properly, then that will make it have got that upper hand to reach some of these donors who roam in the digital space looking for, maybe you can find a well-wisher, a donor, or even an investor who may want to partner with an organization like Kehpca. And so trending in the digital space becomes very key. Branding opportunities should be offered, like what Equity Afya has done. So an agreement can be made with some institutions who may want to establish maybe a few centers for palliative care, so that then when they take the Kehpca logo or name, they pay Kehpca. So with that, Kehpca will be earning money. So what is happening with Equity Afya, if I may give I give that as an example.
Probably Samuel, because of time, but we take those recommendations, and thank you very much for that input, and we could link up with you probably later so that we can also hear more and get the sharing, but we pick that. Thank you very much. We truly acknowledge. There are two comments which I would want to go through, and then probably we bring it to close. There was a food for thought around how we can do together as palliative care providers and how we can remain focused on the same vision. Thank you, Dr. Mwinga. Catherine acknowledges that great presentation and social enterprise has spoken volumes. Bill Ha says, through the training and webinars provided by Kehpca, the Child Life team at MTRH has helped children on palliative care and their families deal with pain and stress. Effective communication and pharmacological pain management, among others, have been of great help. Wow, that energizes us. Thank you so much. Catherine says, on palliative care training for children, are there free trainings, at least mostly on basics for volunteers in the organization? probably what I can say, we run different initiatives, which sometimes are funded by different organizations. Like right now, we are implementing an initiative supported through a donor called Foundation S, and it's we're responding to palliative care needs for children, and this is ongoing. So, Catherine, we can have more conversations one-on-one and see how we can partner and how you can be part of, or you can benefit from such kind of an initiative. I want to run to the QA and see whether there is any write-up. Robert says the session was very insightful and informative. We acknowledge. Thank you very much. And since it's already 8:32 and I don't see any other question, I must acknowledge again Jessica for agreeing to give us and share knowledge with us. Again, I must acknowledge the great and wonderful team behind the success of Kehpca, including our board members. I saw a few joined, which is quite great. That means we're pulling towards the same directions. Thank you, everyone who provide palliative care directly to patients and families. We cannot be where we are without you. And everybody that supports palliative care in a big way or in a small way, please feel appreciated, especially for members and for friends and potential members. I wanted to make an announcement that on the 15th of November, we will have our AGM. It will be in Nairobi. We want to meet you in person so that you build, or we build, palliative care together. We're hoping that you will purpose to come. We will be communicating officially the way we do, and we are inviting you. There will be opportunities for a few board members based on our memorandum and articles of association, and all that will be communicated officially. So keep us engaged, and when we have those kind of communications, please provide us with feedback. We also will be visiting several sites and talking palliative care. We encourage you to engage the county health teams. There is a discussion on chief or chief, and I would love that all palliative care providers engage their regional offices so that when we push for insurance and support, it's all of us together. And there are many things that we can do together. So we have you in our minds and in our planning. Your feedback to us is very welcome. Interact with us on social media. And for now, we put it to close, and we wish you a good night or a good morning, depending on wherever you are. Let's continue to propagate palliative care. Thank you, Jessica. Thank you, everyone. God bless you and have a good night. We close at that. Bye-bye.